Heart failure, a condition where the heart struggles to pump blood effectively in the body. 50% of Indians die within 5 years of heart failure. 27% of deaths occur in India due to various cardiovascular diseases. Why are Indians so gravely affected? We dive into the details of understanding the condition, symptoms, and importance of early diagnosis, and how heart failure affects people of different genders.
What is heart failure basically? Heart failure is a condition when heart is not able to pump blood efficiently to meet the metabolic requirements of the body. There are two types of heart failure. One is systolic heart failure when the heart is not able to contract properly. That is called the systolic heart failure. When the heart is not able to relax properly, it is called the diastolic heart failure. Now coming to the point why there is a rising trend of heart failure worldwide. So there are certain factors responsible for the rising trend. The most important is lifestyle. Unhealthy dietary habits, lack of fruits and vegetables intake, lack of exercise, that is called physical inactivity, smoking, excessive alcohol consumption, sedentary lifestyle, and the rising prevalence of diabetes, hypertension, obesity are become increasingly popular worldwide, and that is why the trend of heart failure or the rising prevalence of heart failure worldwide is seen. Certain environmental factors like stressful lifestyle, corporate pressures, corporate competitiveness, lack of sleep. These factors are also responsible for increasing number of coronary artery disease or heart failure worldwide. So today we have chosen a topic, is there any gender difference between the male and female symptomatology in heart failure? If you talk about the typical symptoms like shortness of breath, excessive fatigue, these are the two typical symptoms which is common in both male and female. But there are various atypical symptoms or atypical presentation of heart failure in females, especially nausea, vomiting, ghabrahat, giddiness, bloating sensation, sleepless nights, sleep apnea, irregular heartbeat, feel of irregular rhythm in the heart. These are the atypical presentations or the atypical symptoms more commonly seen in females. But these symptoms are seen in other pathologies other than the heart failure. But if these symptoms are present with the typical symptoms, then must consult a cardiologist to diagnose or to rule out the heart failure symptoms. There is one symptom that is called the ankle edema and excessive urination at night. This is again one of the most common or one of the more common symptoms seen both in male and female. Now, why females have atypical symptoms? There are researches going on. Why is there any hormone responsible for this variation in the symptomatology of male and female? If you talk about the hormonal change or the hormonal responsible, I can say the estrogen is the only hormone presented in female body that is responsible for the protective effect of any heart disease, coronary artery disease and heart failure in females. But once there is a menopause, this protective effects decline and the proportion of the heart failure in both male and female or the prevalence of heart disease and the heart failure is equal after the age or after the menopause, especially after the menopause. The rising trend of heart failure is more commonly seen in the females. One of the most important factor, if female during pregnancy, if there is an hypertension or infertility during the age of 20 to 40 years, such females are again more prevalent for the development of heart failure as compared to the male population. If females and the male population is having same prevalence after the age of 50 years, now what is the difference? What is the prognostication? What is the prognosis? So female population generally have a worse prognosis as compared to the male population if you talk about the heart failure. And why? There are certain factors responsible for it. One, atypical presentation in female delays the diagnosis and the treatment. Because if patient presented with the typical symptoms like shortness of breath, excessive fatigueness, pedal edema or the swelling at the ankle, then the diagnosis is a spot diagnosis for the heart failure. But if any female presented with atypical symptoms, nausea, vomiting, bloating, then the diagnosis is difficult and the delay in diagnosis lead to delay in the diagnosis of heart failure, delay in the treatment, that lead to the recurrent hospitalization and increased mortality or the increased death seen in the female population. Another factor is a biological factor, that is certain medication that works better in male not works better in the female population. Third most important factor is a socio-economic factor. Indian females or the worldwide females consider themselves as, no, these symptoms are because of the gas and something else, but not because of the heart disease. So they reach hospital or the doctor at a later stage and the disease has already progressed. So that is why the prognosis of heart failure in female population is worse as compared to the male population. If you talk about the treatment option, the treatment options are same both for the male and female. The most important is again the lifestyle, control of lifestyle, medication. The focus is how to reduce the progression of the heart failure. So there are certain medications available in the market that we can provide to both male and the female population. There are certain procedures like angioplasty, wall surgeries that can decrease or the progression or the incidence of the prevalence of heart disease. Now there are certain surgical and non-surgical therapies available for the heart failure patient like combo devices, ICDs, and the most important is left ventricular assist device, which is available in India for heart failure patients, and that is a very useful device for the patient who is having class 3 or class 4 heart failure symptoms, and that can give a bridge to heart transplant, because finally the best modality for the heart failure treatment in class 4 patient is heart transplant, which is not easily available, but definitely it is the best treatment option. But as a bridge, we have the option of left ventricular assist device, which is a very good option for the patient who is suffering from the heart failure, and that is working both in male and female equally good. So my message to the population is refrain yourself from the tobacco, alcohol, increase salt, increase sugar, and live a healthy diet and live a healthy lifestyle with good amount of exercise, at least 30 minutes every day, and reduce your junk food intake and eat lot of fruits and vegetables every day. Thank you.